How's it going, guys? We have a past level question for hematology step 1 internal medicine 2CK. 50-year-old woman. She has 6-month history of progressive fatigue. Vitals are normal. She's a vegan, takes a daily multivitamin. Question wants to know which of the following most likely to be seen in this patient. We have this smear here, so let's just hop to the answer choice here. Choice A, 30% blast, correct answer. Diagnosis is AML, acute myelogenous leukemia. And then we've got the R rods here. Don't worry about M2 versus M3 in case some students get hysterical about OMG, 1517 translocation, APL is more likely to have R odds. USMLE doesn't give a fuck, okay? I said this is past level. Some of you are discontent. You wish this were more difficult. This is what's going to go down. There's two ways they're going to ask you AML on USMLE. The first is they'll give you this very buzzy image of the R rods. These are myeloperoxidase containing, and if we treat this with all trans-retinoic acid, we cause differentiation of blast forms into neutrophils, also lysis of some of these leukemic cells, and the R rods can lead to the precipitation of DIC, disseminated intravascular coagulation. And USMLE wants you to know that you give allopurinol, which is xanthine oxidase inhibitor, to prevent tumor lysis syndrome. But this is a very buzzy image here. So the first way they ask this is by giving you the R rods pick, very buzzy, very easy. The second way is they won't give you an image. They'll just give you a picture of some sort of hematologic condition. You're not really sure what's going on. And they just say 30% blasts, 50% blasts. That's all they're going to do. That's AML, okay? So let's just hop to the others here. Choice B, eosinophilia, wrong fucking answer. So it's high eosinophils. And I can make note that this will be seen three main reasons on USMLE, three main etiologies. The first is helminth infection, which makes sense. The second could be allergic reaction. Okay, so they might say drug allergy for post-surgical patients. They give you a big fucking paragraph and a lot going on, and they just say eosinophils 12%, and the answer is drug allergy. And then the third way is going to be adrenal insufficiency. I've made prior clips on this. This strikes students as a surprise. They'll just give you easy vignette of Addison disease, fatigue, hyperpigmentation, low sodium, high potassium, metabolic acidosis, eosinophils 25%. Students like, what the fuck? It's not a big deal, okay? You get eosinophilia with adrenal insufficiency, also Waterhouse-Friderichsen syndrome. It's because cortisol plays a role of helping to sequester eosinophils within the spleen. Also, additionally, it can help induce eosinophil apoptosis. So if you have low cortisol, Addison, Waterhouse-Friderichsen, low cortisol and low aldosterone, but low cortisol can help promote eosinophilia. Wrong fucking answer. Choice C, hypersegmented neutrophils. Wrong fucking answer. So threw in the fact that she's a vegan. Okay. Well, she takes a multivitamin, presumably it has B12 in it. And then we got this image here clearly of our rods of AML. So some students think I'm playing gotcha. I'm not. This is easy. USMLE occasionally does stuff like this. So hypersegmented neutrophils you're going to see with B9 folate as well as B12 deficiencies. And you get megaloblast anemia, normal MCV 80 to 100. So you have an MCV greater than 100. Wrong fucking answer. Choice D, 90% lymphoblast. Wrong fucking answer. Refers to ALL. Acute lymphoblastic leukemia. It's going to be a kid, okay, school-age kid or younger, and you're just going to have fatigue, and they'll say leukocyte count is 50,000, 90% lymphocytes. They won't even say lymphoblasts necessarily. They'll say lymphocytes, and you need to know it's ALL. If they tell you that there is a kid who has high leukocytes where it's all lymphocytes, and there's a cough, and post-tussive emesis, which is vomiting after the cough, hypoglycemia, that's pertussis, not ALL, because pertussis can cause reactive lymphocytosis. It's extremely important that you know that. So 90% lymphoblasts, classic for ALL, could also be seen, as I just said, with pertussis, but they'd say lymphocytes. Down syndrome as well, you need to know, can cause ALL. Wrong fucking answer. Choice C, relay formation, wrong fucking answer. Buzzy for multiple myeloma, okay? Plasma cell neoplasia. So plasma cells normally secrete immunoglobulins. So you're going to get an IgG, a kappa lambda light chain spike, which is known as your M protein spike. So those immunoglobulins are flying around. They can stick to RBCs, and the RBCs stick to each other, and then they precipitate as rouleau, so high ESR, okay? They sediment more easily. And of course, the proteins, those immunoglobulins floating around, deposit in the heart, cause cardiac amyloidosis, in the kidney, cause renal amyloidosis, it's type of nephrotic syndrome. You get hypercalcemia, and of course, the proteins in the urine, Bence-Jones proteinuria. You can get Pepper-Potts skull lytic lesions, which causes your hypercalcemia. You can get a high MCV in multiple myeloma as well. They can just say MCV is 108. You're like, that's really fucking weird. I agree with you. I've seen on NBME questions. Wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe my channel. Appreciate your time. That's it.